We're recording.
Hello, everybody. Welcome back to Medical Monday.
Hey, everybody. Welcome back.
We're going to be going over plantar fasciitis. What that is a pain in the bottom of your foot that actually has about 1 million patient encounters in the medical world per year. We see 1 million patient encounters.
Wow.
That's a lot, but
That is a
they're
lot.
really grouped between a certain age group. Between 40 and 60 is where we mainly see patients report with this condition, unless you're an active runner. So runners, we do see at a younger age, and it really depends on their shoe that they're wearing, the
surface they're running on. Actually, the distance they're running. Have you trained to reach that point? Because a lot of times it's overuse or
all right. Actually, they can probably just edit that out.
Okay.
All right. Hello, everybody. Welcome back to Medical Monday.
Hey, welcome back.
We're going to be going over plantar fasciitis. What that is an inflammation, pain in the bottom part of your foot. And we see this with about 1 million patient encounters a year in America.
Yep.
And it really involves patients between a specific age range, about 40 to 60.
Yep.
But if you're younger and you're very active, i.e. a runner, we do see patients at a younger age because of improper shoe or the distance that they're running, or even the surface that they're running on can create this pounding motion over and over on the foot and have it inflamed. And that's where we see this plantar fasciitis come from.
Yes, it does. Are you ready to reach the distance that you're running, especially with that younger group? But then even running in general, sometimes in that 40 to 60 age range, it happens more prevalently even when we're just beginning that process of training. So it can definitely.
The good thing is about 2/3 of the time, it's only 1 foot.
1 foot.
Now, 1/3 of the time, it's both feet. So you got a pretty good chance of it hopefully being just 1 foot to where you only have to deal with it and you can get it taken care of.
Yep.
All right.
And there's a lot of complex things associated with the foot. We're specifically talking about the plantar fascia. That's why it's plantar fasciitis. And so the fascia part of the foot, that's the bottom of the foot between the fat pad and the bones.
And the bones.
That's the area. That's why it's called the fasciitis. It's inflammation of that. And so when you're eating a steak, a lot of times it's not the gristle part of the steak, but it's truly the sections of the steak that actually separates it from one muscle group to another muscle group. So with that, the plantar fascia is the part that covers the bottom of the foot, and there's actually a fat pad that covers it, the biggest part being right here on the heel. And so that's what happens is it gets inflamed and irritated and sometimes tightens as well.
And this is where you see at the bottom of the heel, that fat pad is so vital. Without it, you're continually pounding on that bone and inflaming that fascia, which is what separates the muscles. Sometimes you'll even get bone spurs in the foot from this. Now they come and go, just like plantar fasciitis comes and goes, but we don't typically take x-rays for them. It's usually just a point tenderness that you will feel, and then we know what we need to do to help treat these types of patients.
And that's exactly what I was about to share. Typically, plantar fasciitis is very point tender, right where that fascia attaches to the heel bone, where you can see that circle there. So typically it's very specific to be able to touch and palpate. Yep. And there's 2 ways that it can be caused, right? They have 2 factors that are pulling on it. We have the plantar fascia itself, which is the bottom of the foot and helps to hold the arches like we've been talking about. But there's also the Achilles tendon. The Achilles tendon on the back of the calf or on the back of the heel there, if your calf is tight, then a lot of times it can put a pull or a stress on that bone in the opposite direction. So there's a tug of war happening there. So calf stretching is a phenomenal way to actually help take care of and work through that.
So when you look at plantar fasciitis, we know that it's from activity. We know that it's from repetitive pounding or motions of like runners. But what do we do for treatment? Oftentimes, there's a lot of treatments that you can do at home before seeking professional help. Knowing that pounding is what causes it, we can always decrease that. And then also knowing that there's tightness within there, especially if there's Achilles that Dr. Gabby was talking about, is also putting stress on there. You want to stretch that area. You want to stretch it very good before and after all activity. But there's also rest. We don't want to just stretch.
Yep. And recovery, right?
Rest and recovery.
When it's irritated, but also recovery. Ice baths is one of the best ways to remove and reduce the inflammation in the bottom of the foot. So that is a definite option. Typically is one of my first recommendations when somebody mentions like, oh, I think I have plantar fasciitis, ice bath.
Not necessarily in a 55-gallon drum like this, but you can take a small bucket at home and place your foot in it. Or your whole body, doesn't matter.
I think everybody knows by now I like to find the extreme pictures.
Yeah, that is the extreme version.
Yes, it is. But yes,
your
just plantar
fasciitis doesn't go all the way up to your waist.
No. It's in the feet. It is
just
in the
foot.
feet. And you can do the opposite type of bath as well. The ice bath is going to help remove the inflammation. The hot bath, or if you do like a warm water bath, that's a phenomenal way to increase blood flow to help with the recovery as well. You just need to make sure that you stretch it and work that as it cools off and it vasoconstricts back.
And part of stretching the calf is very simple. Here's a very inexpensive, you can go to Academy or Walmart, Amazon, anything is going to give you multiple different options, very cost effective for stretches at home. Now this patient has a straight-legged stretch, but then we also want to bend the knee and stretch.
Yes.
So there's two muscles in the back of your calf, and to stretch both of them, one with a straight leg like this and one with it bent.
With it bent, yep, to hit those two muscle groups on the back of the calf.
So those are things you do want to do, but we also look at, well, what do we not want to do? These are the things we want to avoid, and these are the things we want to decrease.
Yes.
At all, we want to avoid being barefoot walking. No flip-flops and no flat shoes. You need something for support, okay? Plantar fasciitis in the foot comes from either too much of an arch or too little of an arch. So that's what really causes this. Granted, running or activity makes the arch move, but we want to support that arch where it should be. Not too much, not too little.
Yep. And that's why we need to decrease some of those activities. So when you know that you're running, sometimes we need to decrease the distance or how long we're running. So there's
or the surface that we're running on.
The surface, absolutely.
If you run on grass, that's a better option.
Yep. Jumping and dancing typically have more impact. So when we talk about what we're trying to fix, when you're pushing and pushing and pushing, it keeps putting a lot of stress on those joints, and we need them to recover. So those are some things you can do to help recover and see if it's something you can take care of at home.
I know that one of the first at-home options we had was the ice bath. Oftentimes what I tell patients is just get a water bottle, place it in the freezer and let it get frozen, and then put your underneath your foot and just run over it. Roll it over or roll your foot over the water bottle, and that'll really help kind of relax that tissue, cut down on some of that inflammation.
And if you have both feet, you can do it on both feet at the same time. Just freeze 2 water balls. There you go.
Quick fix. There you go.
Quick fix.
If you've tried some fixes at home and you're having problems, you know, the next step is always, well, let me go see a professional. Okay. One of the things that you'll initially see is tape. Tape is a great option to help support those muscles.
So taping, sorry about that pause there. Taping is a great option in the sense that it's similar but different than bracing. So a lot of times we want to brace to immobilize, but we don't want to immobilize the foot when we talk about plantar fasciitis. So the tape actually helps to support and assist with the tissue movement so you can still keep in your activity and recover more efficiently. So it definitely allows and helps with that process. And it's very common, especially with physical therapy and other chiropractic offices.
It's great to assist those movements because we don't want to stop those movements. Stop moving is not the option. We need to still continually be active. Granted, we want to adjust the activity that we're doing and also support those muscles, but we want to maintain as active as possible. Now, there's also steroid injections. So here's a patient getting a steroid injection directly into the Achilles, right there at the heel where it's really point tender, where a lot of patients have problems. Steroid injections we typically think of for the joint space. If somebody's got knee pain or shoulder pain, they're getting a steroid injection. Same concept here. It's going to help decrease that inflammation. But we need to really be careful with these steroid injections, not just because it messes your immune system or your blood sugars, but because the Georgia Baptist Medical Center did a study. And there was about 765 patients in there with steroid injections. 51 of them had their Achilles tore because of the steroid injections. So of the 51 that had the Achilles tear, 43 of them actually had steroid injections. So people have Achilles tears, but steroid injections are more common of a cause. So we want to be very careful with those.
Yes, they are.
Yeah. So if you've tried this or you don't want to go down the route of other methods, there's multiple things that we can do here within the clinic to really help alleviate this pain to get you back to running and being as active as you want to be.
Yes, you are correct. The percussor tool is one of them. So we can definitely utilize vibration therapy and massage techniques to help break up and increase blood flow to that tissue area. So we would utilize this on the bottom of the feet so that we can increase blood flow and allow the tissue to recover more efficiently.
Perfect. And
Yeah.
that's what you want to do. You want to break up that tissue and also support the utilization, continued use of that foot.
Yes, and then also adjustments. The adjustments are very important in regards to getting movement in those joint spaces. The better movement we get in those joint spaces, the better movement we get, the better we recover, the better we perform. And so we're able to utilize our feet more mechanically, advantage when we get those bones aligned and allow the ligaments and muscles to work properly.
So part of the overuse is if there's a misalignment, it's going to have more pain much faster because it's misaligned. Once it is aligned, then you can run better, you can run further without pain. It's always a better option. Yeah. Some of the other things we think about is a support. We talk the arch of the foot, either too much or too little, has a big effect on your plant. Professional grade foot levelers to ensure you have a great arch, a perfect arch.
Yep, exactly. This is also a phenomenal tool if you are a runner. So a lot of runners use either specialized shoes for running, or they have inserts to allow those specialized shoes to be more comfortable and allow for better recovery and better performance.
Yep. One of the other options is it's a soft tissue. So you need blood flow. You need your own body's ability to heal that area, but the fascia doesn't actually have blood vessels to it. So it just takes the nutrition from the surrounding tissues. Well, we can utilize that really helps speed this along. It's called platelet-rich plasma. That's where you take the patient's own blood, you concentrate it as you see over here, just for the platelets, just for the growth factors, just for what's going to be needed to actually heal this damage and put it directly into the heel. So it's a great option to help that fascia heal much faster, but it doesn't have the side effects of worry and concern of the Achilles breaking. So it's a great option when you're concerned and you want to have less risk. This is a phenomenal way to help that along.
Yes, absolutely. And when we use all of these together, the percussion point therapy, the adjustments, the orthotics, as well as the PRP, the recovery process, the ability to really bounce back and get back into those activities with the comfort, we always want relief.
Yep.
This is a phenomenal package or combination of
I like that you say package because that's just it. It's not just one magic cure. Oftentimes with plantar fasciitis, and you need a team and you need a developed plan so that you can get better much faster. All right. Plantar fasciitis, we know what causes it, and we kind of know the age groups it mainly hits. But then you guys have got some great tips to do at home so that you don't have this, and you've also learned some other treatment methods out there to try and help patients overcome this plantar fasciitis. This is it for Medical Monday, unless you got anything.
I don't think I have anything else. I hope everybody has a great week. We'll see you
Y'all
next week.
too. See you next time.